forward.
Okay.
Okay, thank you.
Mhm.
Okay, all righty, because it's, okay. What I'm gonna do is I'm gonna go ahead and share my screen here for just a minute. We'll get that going. And then we should be smooth sailing from here on out, okay? As long as Rosanna can watch the people to let in, okay? What we want to talk about tonight, I'm going to be hosting this. I'm Mary Schmidt, the National Sales Director on the team. And my co-host is going to be my friend and business partner, Janice Johnson, also at NSD. We're on the same team, and we want to talk about benefits tonight. Benefits are, so it's what we're all about, whether you're just a member, you're enrolling somebody that way, or you're bringing a new business partner on, a benefit consultant. We're all members. We should all be using the plans. So what I wanted to do is show how the company has so many resources readily available for us to use for the plans. Okay, we obviously have our Save with Discount Healthcare website, but if you go into the back office, you're going to see so much information that you can use. So I'm going to open my e-kit. And first I want to show you, you have your brochures, the dental, the telehealth, the deluxe. If you would open the deluxe, this is what you can use to share with people. I always consider this something that you'd want to use in a professional setting. That's to say that when I'm putting out flyers about our plans, I just have a bunch of flyers made up. We also have those both on Team Eagle and on my site, where we have it in English and Spanish and several different ones. I like to think of those that you're going to stack out a stack of them somewhere. But if you're going in to meet with a business owner or just a one-on-one presentation with somebody, you probably want to take a brochure. And if you scroll through, the new one now says telehealth. It shows in-office doctor visits, hospital benefits, ancillary medical services, dental, vision, prescription, and chiropractic. And I'm not going to go through it. It's not that long, but it's nice and to the point and gives you the information you need, as you can see, to be able to share with people. Now, I'm going to out of that. Oops, wrong thing. Are you guys still there? I hope I didn't close the wrong thing. Okay. I'm going to go back to the e-kit. And what I wanted to concentrate on tonight is the member guide. And I'm actually going to use the AmeriPlan Deluxe guide tonight in talking. You can see as the cover looks the same. Before I go into that, I want to say that one of the things that's really important is that we all encourage not only our benefit consultants, but our new members to get the AmeriPlan app. Everything's going by way of the AmeriPlan app. I did find out today that when they get the email from corporate, one thing we were concerned about, and we were looking into it, it didn't include the group number. So for somebody to get on the AmeriPlan app, they have to be able to put in their member number and the number. Well, they explained it to me today that if they use what's called a smart link that comes in their corporate email when they first enroll in a plan, if they click on that, it's called a smart link. All they have to do then is enter their email, which recognizes them from the email we use to enroll them, or they use, and a password which they create. Okay, so they will not need the group number. Okay, so that's important to know. Now, if they don't use that smart link, then you're going to have to provide them with the group number. Okay, you may have a member, you have members that have been on the books for a while that didn't ever, we didn't have the member app. So if they wanted to start using the member app, you simply have to give them the group number, which is the same for everybody. It's on your card. And I will show you that when we look at the card. I'm not going to go down to that yet. So the reason it's important for them to use the app is that is how they're going to have their card. They can see both sides of it. Now they can call and request one, but the other thing is they're going to have their member guide. This member guide is so detailed how they use every single part of their benefits. You know, this is really going to help them when they have questions. The other thing on the app is where they can do their provider search. It pops up, you put the zip code, it pops up on a map. It shows you the different areas that you might want to select. You click it, then you can get right down to the providers. Okay, so the corporate email gives them that information, but I also and many of us send out a welcome email to our members. And in mine, I outline some of the important benefits of using the member app. There is no longer the member portal. You can open it on, I think you can still open it, but you really can't do anything on it anymore. Okay, so they've totally gone away from the member portal. So always, be encouraging. I just enrolled a new member yesterday. I asked if she was okay with using apps on her phone. She said yes. She was working on doing that this afternoon, asked me a question, and I said, well, did you use the link in the email? She said, oh, let me go back and try it that way. So I hadn't heard back from her, so I told her, let me know if she has any issues. So I'm going to assume that she was able to do it through that. So again, now if we start looking, oh, and also on the member app, if you've looked at it or been on there, I mean, you can see each of the plans. There's all kinds of information that's available. Okay. Now in the member guide, I mean, there's a lot of information. I'm going to just scroll through, won't be stuff that we're really going to concentrate on, but it does tell you up front, not insurance. We know that it's a discount plan. There's disclosures. And now here's the table of contents. So if somebody specifically wanted to find out about their vision program, they just come down here and they know to go to page 6. Okay, they wouldn't have to scroll through the whole thing. So as we go through, it gives some general membership information. I'm going to enlarge this a little. This is where it shows you, they get to see what their member cards will look like. If you see the bottom of the deluxe and on the bottom of the dental, vision is now through Outlook Vision. We used to be coast to coast. As of January 1st, it switched over. Now, when I looked at providers in the network and Outlook, it was very similar to what was with coast to coast. I looked at the discounts, looks very similar to what was with coast to coast. So it's important that you know that, so that, if somebody asks that question, because when you look at the information, how to use your vision, it tells you, say that you're with Outlook Vision. Okay, before we said we were with coast to coast. Okay, so that gives you, and what I wanted to also look, like here's, I was just looking on the back, it gives them, if you can see here, it gives them a phone number for customer service. It gives them the link if they want to go online to look for a provider. It gives them the telehealth. It gives the pharmacy information. And then there's provider support and member verification down here on the bottom. I was also looking, and anybody that can see this can tell me, I was looking, where does it actually give the member number and stuff? I don't actually see. Oh, that's because it's a generic card. Boy, that was silly of me. Okay, there we go. All right. Anybody that wants to speak up, you don't have to stay muted. So Janice, if you have anything you want to share, don't hesitate. Okay, now it tells them right here, if you prefer to receive a membership ID card through the mail, here's the number they can call. So we've been talking about that. You want to make sure you offer that to your new members going forward. I offered that to my new member, and she didn't say anything. So I think she's okay with the app. Now here's, I'm not going to go through all that. It's about if there's any complaints, if can. And so on. Now it comes down to we have a wide selection of providers that we can go to, but it is going to vary by area. Janice will talk about a little bit later about the provider search and how you're not limited even by area or state where you go to see a dentist. You're going to say, this says 15 to 80%. I like to break it down for people and tell them that at the general dentist, you're going to say 55 to 80%. If you go to specialists, I believe most places now it's 20 to 25, but you could say 15 to 25. I also like to tell people that if you go to a general dentist that does more procedures, like my dentist does root canals, he does crowns, there's a lot. They also have an orthodontist on staff. Now the orthodontist is separate, so it does go as if you're going to a specialist and default to the percentage off. But if you go to a general dentist that doesn't do a root canal and a crown, and you're sent out to a specialist, you're going to have a lower savings. So I tell people it's best to try to find somebody that does those things. And there are many dentists that do the more complicated procedures. Okay. It's also important, no waiting period before you use the program, no limits on how often. There's no exclusion on ongoing procedures unless you've already started orthodontic treatment. And as you know, that's a whole total package that people sign up for. So they would have to have this plan before they actually sign that with their provider. Okay. And another important thing right here, you know the discount amount you will pay. I hope you guys can see my little cursor on the screen. It's not very big, but or mouse. And Janice will also talk about that when we do the fee schedule. Okay. This just goes in selecting or changing program. I'm going to tell you, you can switch dentists at any time. There's people that use maybe coverage they already have with a dentist, and when they need to use the AmeriPlan, they switch to a different dentist to be able to use it. Okay. And tells them stuff like what to expect on your first visit and so on, missed appointments and so on. We'll go all the way down. Now, when you get down to the small, the vision program, it does tell you it's administered by Outlook Vision. And it tells you it's contracted with 11,500 optical centers, and discounts are 10 to 50%. You're going to save on the glasses, the frames, the lenses, the tints, the coatings. There's a program for contact lenses. There's some, you can do mail order glasses. There's all kinds of stuff that you can do with this. And remember, as any vision plan, most of them, Janice will know better, but most of them are discount plans, right, Janice? And with them, you don't get to use the sale that's running at the Vision Center or the special prices and our plan. It's one of the others. Okay, you're going to go in some that are running a, pay for a full set of frame lenses, tints, glasses, all that, and gets a second pair free. Or you get 2 pair of glasses for $89.95 all inclusive. You don't get our discounts on top of that. But many people opt to go in, and instead of going to the special, $89 and $99, they go over here to the $200-300 frames. They want to get a nice pair of glasses. They're going to save on everything. Okay. They don't have to go to the least expensive, and sometimes they can do really well. And that way they can price it. They can, figure out which is a better price within their budget. Okay, so this just goes into information about, it gives them a number they can call if they need help getting a provider and so on. It gives them information about replacement contact lenses, see mail order only. There's a lot of detail there. You can also get LASIK vision correction. Okay, with this, they give you the phone number, but we actually have a website. So if you're on the provider search and you click, and Janice can show that, or I can when we go to that, when you click that, it actually takes you to a website that says AmeriPlan. Okay, I called one time just to get general information. I said I had somebody that might be interested in enrolling so they could use this, and they were extremely helpful. They tell you what providers are in the area, and the discount is going to be about 50% off, which is really very good. Okay, if you keep scrolling down, it goes through the prescription program. I won't go through all of that. We might do an RX pricing later. We can show you where that is at to do. And how it works. Now, when you look at our cards on the back, it gives some bin number information. That's what they use at the pharmacy. You also know that if you already have an insurance plan that has prescription, when you go in, you can ask them to run that and your card and see which gives you a better price. Our new company that we're with for telehealth also runs a prescription program, and their pricing has gotten very similar on some things to GoodRx, which means our pricing, I feel, on the things that I've compared it on is a lot better. We have a lot better discounts. Okay. This is just some more information. There's also a home delivery pharmacy program. You actually call and you set it up. You can do reorders on your prescriptions and everything. That's a very convenient way to get your prescriptions. This is all prescription. So when we're thinking, are our members getting enough information? They're getting it. Now it's a matter of they're looking at it and using it. Okay. When people call you and like, oh, I have no idea how to use this or that. I think about my own with a major insurance company, or when you're on Medicare or my husband's plan, man, I got to go through hoops to look stuff up. And sometimes I have to call and they have to direct me. But it is research to know how to use your plans. And our plan is really no different, except really it's a lot simpler. Okay, then there's the chiropractic program. They get 30 to 50% off chiropractic care. It's 50 off the diagnostic and x-rays, and 30 off treatments and most other services. Again, it goes through how they would use the program. Then we get into our new telehealth program. I've used the telehealth, and I will just tell you without looking at this how it worked. I called in. They took my $20 payment. They set up a time. They asked me if I needed a call back that day or the next morning would be fine. I said, could I get a call back today? It was about 2:30 in the afternoon. They said, we can schedule you for 4 o'clock. What's really nice about that schedule, if you ever use telephone, if they call back and you happen not to be at your phone, you missed your call. You got to call them back and say, hey, I didn't get my call, and they will call you back. But with this, you can kind of designate yourself to be near or ready at the phone. Okay. You give them your symptoms, you discuss it with them. If they think they can call you in a prescription, they'll ask you where you want it called in. So if you're using AmeriPlan or something else, you want to let them know what pharmacy. And if you're using a pharmacy in our network and you're going to use our card, then you'll get those discounts. Okay. Now, I don't know, I didn't really see in here, yeah, down here, scheduled appointments. Now, this is if up here it tells you, I don't know if you can see where my cursor is, but based on the visit, the telehealth provider can write a prescription, give medical advice, or recommend follow-up with an in-person doctor, specialist, or testing. Okay. And then here's the information, what they have to do that. Now, it does also tell you on the brochure that we would be showing people is that visit is a pre-negotiated discounted price. Okay, we heard Joe Kerr talk about on the corporate call for a couple different weeks in a row that people were somehow getting the misunderstanding that it was $20 for telehealth and that covered going into a doctor. Well, that would just be simply awesome, but there is nothing that's going to be that inexpensive, but they are going to get a discounted rate. Okay, so that goes through information on that. And then we go into our advocacy program. As we know, this will negotiate bills that are over $1,500 total, whether it be a hospital or a surgery center, and it will include everything related with that particular hospital stay or surgery center visit. It does tell you here it's contracted with the CARES Group, one of the largest hospital patient advocacy organizations in the country. It's not insurance, does not provide funds to pay bills, and they'll make their best efforts. Results cannot be guaranteed. We have heard some outstanding results. I don't know if anybody on the call later on wants to share anything if they've used it, but I've heard some really good results from that. You do have to, like I said, it has to be over 1,500. The way this works, when I used it one time, is I called AmeriPlan. They gave me the CARES number, and then I called there, and that was actually for the rep for AmeriPlan. And she spoke with me, and she told me that she would send me an email. That email had a form I had to fill out, and then I had to, and I did this as an attachment to the email because I had gotten all these things from my bills by email. And so I was able to send them to her, but I suppose you could fax or mail, but I had to send her everything that was related to the surgery. And then they just go to work doing the negotiation directly with the hospital, and they will try 2, 3, 4, how many times it takes until they get a response that maybe, this is all that can be done with the negotiation. And they talk directly with you. They don't go back to AmeriPlan. All the communication is directly with you and the CARES Group. Now, the one exception to our benefits being effective basically in 24 hours once your application goes through is this. It tells you right here, there's a 3 business day waiting period from the active date, okay? Not from the day you enter the enrollment. So if you enroll somebody today and they're not active tomorrow even, it's the day they're active. And there is absolutely no exception to that at all. Okay, let me see.
And Mary,
Yes.
I may ask you, at the time that you did your services for CARES, what was it that they charged?
They don't charge us anything.
Really?
No. Now, in my case, they were not able to negotiate a reduction, but that's because I had already done there's some exceptions, like I had already gone as a self-pay patient, and that already took 50% off my husband's surgery. Once you because we'd already done that, the hospital would not negotiate with anybody but us. And I was able to negotiate even more on it. So once you've done any kind of negotiation, but let's just say they had gotten mine reduced, we don't pay anything more to them. That's the beauty of this program, because if you are calling Caris Group independently, it's a $250 fee to have them negotiate for you, and they take a percentage of what they save you. Okay, so for us paying, if they know whether they get it reduced or don't, is fantastic. Okay. Now, so I wish I had a better example to show you guys the savings, you know, but I did pretty good on my own on that one. Now, ancillary services. I want to talk about ancillary services. A lot included that you can get done with ancillary. Now, one is you would go through direct labs if there's certain labs that you want to, like primarily blood work, but other labs that you want to have run. Okay. Now you can either call this number, you have to identify yourself with the code RAMERI, or you can go directly on its directlabs.com/AmeriPlan. You'll see it says AmeriPlan right up at the top. You can search by name, you can search by, like, somebody told me some kind of lab work they needed done, what it was called. I just put the first letter in and it popped up. I found the lab. I told her how much, I could tell her how much it was going to be if she wanted to use that. You pay ahead of time. Everything is sent directly. You find out what lab you're going to. So when you get to that lab, like when I went for blood work and I walked in, I didn't have to pay anything. Everything was already done. Okay. Now there's other things in ancillary services besides lab work. So I'm going to go down here. We're already contracted with a lot of imaging centers. So you can get x-rays, MRIs, mammograms, all kinds of different labs done, and really good savings because it's just over what the Medicare price is. Okay. I have some really good testimonials on that, but I'm not going to go into that right now, because the next thing we want to go into, one more thing. We also have hearing programs. There's several of them. They're listed in the provider search. And I will tell you, when you click on the website or you go to the 800, the number they provide, I was going to show you right here. I could click on this. I'm not going to do it. I did it early. It takes you directly to their website. I do have a member that used this, and she saved about 55% on her hearing aids. Okay. And then there is life screening. Have you ever seen where a church or community center advertises that they're having life screening there on a particular day? That's exactly who runs this. They go all over. It tells you they go all over, and they set up at different churches, community centers, and so on. And it's a really good discounted price. I remember I had called and got the quote for what it would be. It's a good discount. And it's a way to help your community, help your church members and stuff if you can run some of these. All right. Now, the other cool thing is when you get down, there's non-medical benefits, but I was going to scroll down here on this member. I'm going to get there in a minute, guys. It goes into the map, and it actually goes into the fee schedule. And I'm going to turn this over to Janice now, and she can either go from here, or if you go back to the e-kit, it's right here. So Janice, you can hit screen share, right? And you can, do I have to say stop sharing, right? And now you can hit screen share and share your screen. Do you see it?
I do. I see my screen, but go ahead and since you're already open, you can open it.
Okay. Do you want me to go to? I just lost my train of thought here.
Yeah, just go
Hold
to
on.
the EQ.
You want me to go to this one?
Janice, you can try it now. I opened it.
Let me hit screen share again. Oh, who, me or Janice? Janice, are you?
Janice tried. I did it where multiple participants can share simultaneously.
Oh, okay.
Okay. All right.
And if you can't, then I will.
Hold on just a minute.
Do you want me to just do it, Janice? Thank you, Rosanna.
Yeah, she's got it.
Oh, there you go. Perfect.
All right. Okay. I guess you all can hear me okay. All right. If
Yeah.
not, I can turn my volume up. All right, good evening, everyone. Thank you for the opportunity to share a little bit about these great benefits that we have. And I don't know how much we really realize, and at least maybe for me, maybe it was just slow for me, really what an upgrade we have received with these benefits. They are very well received. Just the fact that we are able to give the opportunity for a person to get an in-office doctor visit with a benefit plan, a non-insurance benefit plan that costs $10 a week for a family. I mean, that's huge. It really is. And so we have a lot. I mean, I'm just very thankful for this benefit. I know there's a lot of interest. We just got to get the information out. People cannot enroll in what they don't know about. I came into the business in 2007, and in the beginning, I didn't have, good training, but the websites were what I used. When I found out if I went to the AmeriPlan websites, even though they've been really upgraded now, I knew that if I followed what was on the website, I couldn't go wrong. And one of the things that saved me was this fee schedule, the information with our fee schedule. One of the things with new people, you want to encourage them to come to their back office to look at the e-kit and go to the fee schedule map. Okay. Now, the fee schedule map is important. And I always encourage new people or benefit consultants to print this out in color if you can, because you need the color to know what fee schedule is associated with the state or the area. All right. The states that are in gray are states that we do not do business. When I first came to AmeriPlan, Washington was one of my number one states that I had business in. And I believe that the Department of Insurance took over the discount plans and required only licensed agents to sell discount plans in Washington. And so that meant that everyone that had plans had a discount plan, not just from us, but from other places. Or if you were a benefit consultant, IBO at that time, you couldn't continue. So the states that are in gray, we do not do business in, okay? And so a new person, that is the fact that that the map is color coded, it tells them right away, not to dial or to make calls in that particular, or talk to people that live in those particular states. Now, we have 3 fee schedules, and most of the United States is under the line fee schedule. As you can see, it's when you look at it, you see line, all right? And then we have the red fee schedule, and then we have the teal fee schedule. All of our plans are good plans, okay? They are. One of the things that I had to learn was to have the right mindset about what I was offering. If you are comparing the line fee schedule with the red or with the teal, what you're coming up with is, like the line fee schedule, it's just not even worth having. But that's not true. You have to, don't compare the line fee schedule with the teal or with the red. Compare it with nothing. Okay, not having anything. All right. That's because when people don't have benefits, they don't go to the dentist unless it's an emergency. All right. An emergency is pain. All right. So we have to have the right mindset. And then we have to do some research about the areas that we are working in. For example, when I look at Georgia, which is where I live, all of Georgia is line except the Atlanta area. Well, as a benefit consultant, I have to find out what zip codes are included in this red fee schedule. All right. And once I figure that out, then I will know how to market. When I was brand new in the business, I was telling because I was in the red fee schedule, I would talk to everybody no matter where they were, because I didn't really understand that there were different fee schedules. I don't know whether that it was something that I just missed in my reading, but so many times I would be talking to people in other states, and I would be quoting from the red fee schedule, not realizing that they weren't in the red fee schedule. And so I was giving them the wrong rate. So as trainers, we want to really try to help our new people out by pointing out that, you know, you need to know what areas you're going to be talking to people in. Now, I live in Georgia, but I'm originally from Missouri. Okay. And so I have family in Kansas City and I have family in St. Louis. Now, they are in the red fee schedule. All right. But there are other parts of Missouri, and this includes Kansas City, Kansas, which is, we call Kansas City, Missouri, and Kansas City, Kansas stepsisters. Okay. And the Missouri River separates us, but the people that are in Kansas City, Kansas are also under the red fee schedule. But other than that, all of Kansas, including Topeka and some of the larger cities, are under the lime fee schedule. This is a training in itself. And so it's very important that we lay that foundation. Again, this would be a suggestion would be that if this is printed, take pictures, okay? And and so that makes it better. But you definitely need the colors to know what fee schedule is associated with. Okay. All right. Now let's look at the line fee schedule. All right. Okay. Now the line fee schedule, when you look at it, you can see that there are some limitations. But again, we are not comparing it with the red or with the teal. We're comparing it with someone who has nothing. And so the procedures that have the ADA codes, and what the member pays, there are limited. However, we have to read on this. And as you're training new people, or reminding folks that have not been working the business, and they're coming back, but may have been a benefit consultant for a while, we have to encourage them to read. And it says any procedure not listed, including cosmetics, shall be discounted 20% from the dentist's usual and customary fees. Okay. And so there's a lot of procedures that are not listed, but what we focus on is what is listed, because what is listed, our clients are going to get the larger discount. So diagnostic and treatment, you have the ADA codes, which are the American Dental Association codes. And then you have a description of the treatment. And it says the member pays $16. Okay. The member pays $24 for a limited oral. A comprehensive oral evaluation, new or established patient, the member pays $49. And then it goes on to give all of the different charges or member fees that would need to be paid. So when a person goes for their preventative and their diagnostic treatment, then they will know what they are going to pay. Now, I always encourage clients to take their fee schedule with them. And how do they take it? If they're in the Lyme schedule, I attach it to their welcome email. All right. Of course, like I said, a lot of people don't want to print things out, or, and they can always take a picture of it, okay, and have it on their phone. And of course, with the apps, that's a game changer. But some people are old school and they won't have an app. So this is just another way that they can know. I think it's a good idea. And I tell them, I said, sometimes people are in the office may not be as familiar with our plan. And so it's a good idea for you to know what your plan is paying. And when I go over this information with individuals who don't have anything, they are glad to be able, number one, the cost each month is affordable. You can put your whole family on it. There are no waiting periods. I've got a toothache. I need to get to the dentist. Okay. So I know that if it's not listed, then I'm going to, my discount is going to be 20%. Okay. Now, if a person needs to see a specialist, and like Mary was saying, you want to try to find a general dentist that does a lot of different procedures, okay? And so if they're under general dentistry with the other fee schedules, then of course you would be able to get a greater discount. But if they have to see a specialist under the line fee schedule, it says specialist fee schedule to be used by dentists who have acquired an advanced degree, including, and it gives all the different ones. The fees shall be discounted 15% from the specialist usual and customary fees, okay? Now, 15% is not a lot, but it's better than what? Zero, okay? So you always have to compare it with nothing, okay? Because when
Right.
people have a plan, they will go to the dentist. Now, they may not get the treatment done. They may find that it's still not affordable. We know that dentists charge a lot of money, okay? It's very expensive. I don't care. I have people that I have enrolled into Delta Dental, Blue Cross Blue Shield. Unless they're in a group, they are mad because they spend a lot of money each month for the plan, and they go in and get 10% off or 20% off, and they are just mad, okay? Or they have a co-insurance, where the company pays 30% and they pay 70, okay? They are mad, Now, there's some benefits. I try to look for, because some people just want insurance, and they may say to you, I don't want a discount plan. Or maybe the dentist office have talked so negatively about every discount plan. So that is where, as AmeriPlan benefit consultants, we need to network with insurance agents, okay? And you have a situation of you scratch my back, I'll scratch yours, okay? If I refer a person that just does not want a discount plan, or they are married to this dentist in their mind and don't want to leave that dentist, and I understand when you get a good provider, you really don't want to leave them, but they will leave you. That's one of the things I tell people. Well, I know you don't want to leave your dentist, but guess what? They will leave you in a heartbeat because they have student loans that they have to pay. They got a staff they have to pay. They want to get paid, okay? And so, they're going to do what's best for them. And think about that when you say, well, I'm not going to take this plan that I can afford, that's going to do for you what you need to have done. It might be to your advantage to go ahead and try to find a dentist who's on our provider network, or who we can talk to about getting on the provider network. Of course, that's your choice. But if you find a person who just doesn't want that, then what you want to do, that's your client. You say, well, I want to make a referral. You need to network with an insurance agent that's going to pay you a referral fee for giving them that client. Now, let me just tell you, insurance agents don't make a lot of money on dental. They really don't. The only reason they may make more than what you make and what I make when it comes to AmeriPlan is because it costs more. All right. It costs the client more per month. But when I get a dental insurance client, that opens the door for me as an agent for other sales. So even though I may not make but $10 or $20 on that sale, it has opened up. I now am their agent. So that might be a life insurance plan down the road. It may be life insurance on their grandchildren. I mean, it opens up a door for an insurance agent. So they should pay you a referral fee. It can be a gift card, of $20 for Walmart, or it can get, or they can do a Cash App, they can do a something, pay you on PayPal, but they should be willing to pay you. But you got to network and get with the right agent. I tell people all the time, I'm licensed in 5 states. If you refer someone to me and I make an enrollment or sale as a result of that, I'm going to pay that person, because they didn't have to send that person to me. Every year, the first of the year, I send out gift cards to people that have referred business to me. That blesses my business. And so I bless them with monetarily for thinking about me and having my number and giving it to me. So that's just a, be looking for somebody that you can network with. Okay. Now, with another thing that for those of you that like to get out and market your business, look at terms of get networking with P&C agents that do auto insurance. They can do life insurance, but most of the time they have nothing to do with health benefits. Ask them if they are a busy office, ask them if you can set up a table once a month in their office, okay? And you can buy them some donuts, you can do something special for the office, okay? But find that what you're doing is just giving out information. On good days, you could be out in front, you're the first person that people see when they're going into their office. There's so many different ways that we can give out brochures and tell people about what we have to offer. Okay, so it doesn't matter. Don't be downcast about the Lime fee schedule. It has its advantages for the people that need it. The people that need it are the ones who don't have anything, because that is what we're comparing it with. All right. Okay. So now let's look at the TIL fee schedule. Okay. The TIL fee schedule is a stronger fee schedule. I want to encourage you not to say it's better. Okay. It's stronger. It's a stronger fee schedule, right? Okay.
Good term. Good.
Okay. All right. Because we're speaking positively, about what we have to offer. But it starts right here in your mind. You have to make a decision that you feel good about what you have to offer. Okay. And so I'm not going to go through this, but in the different states that are under the TIL fee schedule, this is a very strong plan. Any procedure not listed, including cosmetics, shall be discounted 25% from the dentist's usual and customary. Okay. And notice they have all these procedures. It's 2 pages. Okay. So when you email and use this as attachment, make sure that you get both pages. All right. And then for the specialist, the fee shall be discounted 25% from the specialist usual and customary fees. Sometimes clients will ask me, why do the specialists charge so much? I said, well, specialists are special. And so we have to pay more when it comes to their prices. All right. Okay. And then let's go over to the red fee schedule. All right. The red fee schedule is strong as well. Okay. And basically any procedure not listed shall be discounted 25%. All right. And of course it's the same with the specialist fee schedule. All right. So these are our stronger, the red fee schedule and the lime fee schedule are stronger. They are stronger fee schedules. Make sure that you are quoting the right fee schedule. Now, when I'm just doing an example, I use the red fee schedule. I don't care where they are. Okay. I'll say, for example, the red fee schedule. If you are under the red fee schedule, that's the way I present it. Of course, once they are, once I find out that they want to get the plan, then I'm going to quote from the correct fee schedule. Matter of fact, we're going to make sure they have providers before we even sign them up. Don't sign up people that you don't have a provider in their area or in the area where they do their business. Okay. Because they're not going to do anything but get mad at you and drop the plan. Okay. And that does not help our residual income at all. Okay. All right. So these are our schedules. Get comfortable with it. For new people, as a part of your training, make sure that this is a part of it. You will not know what to offer if you do not know what fee schedule your lead is under. Okay. All right. And so that's all I have about fee schedules. Mary, where else do you want me to go?
Do you, we be able to go into provider search?
Do
Do you want to do that? I guess we have to go to your website, your safe site, or?
Right. Hold on just a second.
Can everybody see Janice's screen as she's sharing it? Somebody had said they weren't seeing. Does everybody else see
No,
it?
I can't. I saw the green fee schedule, the lime, excuse me, but I did not see the red or the teal.
I don't know why, Roxanne. Does
Yeah.
anybody else want to wave their hand? Yes, no, shake their head? Ed, are you seeing it?
Now I see it.
Oh, okay. All right. Well, we're back in good. Thank you. I don't know. Maybe it just blipped out on you.
That's weird.
All right.
Thank you. Thank you.
Thank you.
I see
All
the
right.
fee schedules, Mary.
Okay. Thank you.
Okay, good. Okay, well, this is my Delivering on the Promise website. I know a lot of people don't use Delivering on the Promise. I do. And I started out using Delivering on the Promise because I got so mixed up. Again, I didn't have a lot of formal training when I first started. And so when I found out that, I call this the combo website, because when you go to Delivering on the Promise, you can visit your opportunity website, which represents I want to make money, or the member website, I want to save money. Okay. Also, and they've updated this. It looks very professional. I really do like it. Okay. But because we're talking about memberships, of course, we would want to click on I want to save money. Now, we also, when you come on Delivering on the Promise, you also have the prescription lookup tool that's right there. Okay. And you can just click on that. If a person has a prescription, and
Just do the sample on the amoxicillin down here, maybe. We'll let you click on it?
I think so. Okay. So the amoxicillin, that's penicillin, generic penicillin. It will tell you what the cost will be for, and I think it's set up, I'm sorry, this is Raleigh, North Carolina. So you're going to put in wherever you are as far as your state is concerned. And it's going to give you the different pharmacies that are part of the network and how much the cost, how much it would cost. And if you notice, Harris Teeter, their pricing is a lot less, than even Walmart or CVS. And so sometimes people will pay a higher price because they really want, they like a certain store. It may be a mom and pop type pharmacy, and they just want to give them their business. But when you go to Delivering on the Promise, that's one of the first things that you can look at. Okay. All right. Let me see if I can get back.
I'm going to chime in real quick, and I just looked up that prescription for that area using GoodRx, and our prices are almost exactly the same.
The same. Okay. Okay.
So
awesome.
I was on my phone, so I just wanted to share that.
Good. That's all right, Dan. That's encouraging. Okay. Let me see something here.
Are you going back to provider search?
Hey, Janice,
Yes, ma'am.
does that happen to work for the technically non-prescription medications that are written as a prescription?
That's a good question. I've never looked it up on that.
I haven't either.
No, I mean, I can't, I don't know. You're talking about something like, let's say, ibuprofen.
Yeah.
800 milligrams is a prescription normally. Okay. 800 milligrams, or you can go over the counter and get the 200 milligrams and take 4 of them, and you got 800.
That's what I do.
So,
Yeah, definitely.
you know, or you can get a prescription from the doctor for ibuprofen 800 milligrams, and, you know, they will, you know, charge you, you know, more money, because you can go to the Dollar Tree and get the 200.
No, but what I'm saying is, because from what I understand is that, unless this has changed, from what I understand is that, excuse me, if your doctor writes you a prescription for a non-prescription medication,
Mhm.
there is supposed to be some type of discount that you're eligible for.
My experience, are you talking about through our program or
Uh-huh.
just overall?
From our program.
Okay. I haven't heard that. I don't. Does anybody else know? Has anybody else heard that?
I would say we could just try putting in ibuprofen 800 milligrams and see what it does. That's all I could think.
Let's see.
It'd be 200 milligrams, so the 800 would be prescription.
Oh, I was thinking if you meant if you put the 800 milligram, if it would
Oh,
do
so
it.
I'm looking for the non-prescription.
Oh,
The technically non-prescription medication written as a prescription.
the only way there's, okay, give me an example of what you're talking about.
Just do Bayer aspirin.
Oh, you mean just why would you need a prescription for that though?
Because if it's cheaper to get it written as a prescription.
You mean a doctor will write it? Well, we're probably going into something that
Yes.
maybe we shouldn't do right now when I didn't know they would
That's
write a
Bayer.
prescription.
That's Bayer aspirin right there.
I didn't know doctors write
I
a
never-
prescription for non-prescription.
Okay, so that's Bayer aspirin, and that's the prices.
Be cheaper just to buy it without that.
You go to the Dollar Tree and get it for $1. Of course, you might
Yeah, I
not
was
get Bayer because it's brand name. I don't know, but I'm just saying. Did that answer your question?
So you can get it for, you can get the non-prescription, technically, oh shoot. Yeah, technically you can get a technically non-prescription medication as a prescription.
See, and this is really set up like Good RX where you get the coupon. That's how Good RX works. So that's, I think they're pretty much doing what Good RX does. You print that out and you just take that coupon to Walgreens or wherever.
Okay.
Janice, can we go ahead and, so we make sure we get this in before we're done, we'll go to provider search now? Because I know some people don't realize all the stuff that's on provider search.
Mhm. Okay, hold on just a minute. I
Oh,
can't get
there
out
she
of
is
here.
again.
Trying to get out of here. Hold on.
While she's doing that, I'm going to say, if you can help your members when you enroll them, understand how to find providers, how to sort by distance, sort by preferred, you have a lot better chance of keeping them on the books because they'll go and they'll use their benefits because they know how to get to, who the providers are in their area.
Okay. All right. So if you are, let's just say that you have a person who is, they say, well, I like the plan. Who are the dentists that are in my area? Okay. And so you want to go to the link on your Save with Discount Healthcare to the provider search. Okay. All right. And you search for a provider using your zip code. That's the easiest way to do it. Or you can use the city and state. Okay. So let's just say I'm going to use Stockbridge, or I can use somebody else's if they want me to. But anyway, I'll just put in the zip code. If you put in the zip code, you don't have to put the city or state. I never have used the last name of a provider because I just want to get the list normally, because normally the providers are not on the list unless they are like a national chain or something. So I'm going to go ahead and search.
And I'm going to say real quick, sometimes the provider, you may think it's under the dentist name, it's under a different name for what he calls his location.
Correct.
So you won't find them. So it's better to do zip code.
Right. And so, so if I'm looking for a dentist, then I'm going to click on this, which it already defaults to the dental link. And then you want to go to general dentist. Okay. All right. If you're looking for vision, you're going to click on vision. Here's the prescription providers, chiropractic, ancillary, and physician. All right. The physician providers are connected with the old plans, okay, not the current plans. I have that benefit because I think I still have AmeriPlan healthcare, but anyway, which had a physician doctor's office visit, okay. So, so let's look at the dental, because that's basically what that's the most common thing that we come for. All right, so we're going to click on general dentistry. And so it has pulled up a list of dentists that are in or near the 30281. Okay, now this website has been upgraded, and you can take your clients or your new business owners to this page as a part of the training. Because you want it, AmeriPlan has put this information, it hasn't always been here, but it has put this information in telling you how to schedule an appointment and even what to say and what to do if you have a problem. So you want to choose the provider you want to go to from the AmeriPlan list, be ready to provide your member ID, call the provider office and say, hello, this is Janice Johnson. I'm an AmeriPlan discount program member. I would like to schedule an appointment. If asked, is this a PPO or DMO? Say AmeriPlan is not insurance, it is a discount program. If the office staff person asks for an AmeriPlan phone number, give them the 800-256-3368. So all this information is right here. Okay. Now let's just say the stars. It says the starred preferred providers. And so you can see that every provider on this list, down to Great Expressions, is a preferred provider. Okay. And I forgot how did they determine who's preferred?
Okay, I can help you with that.
Yeah.
Preferred provider is someone that the corporate office has had contact with. I don't want to even say in the last 6 months, it could have been in the last year. So they're designating them preferred, just meaning if somebody goes to one of them, there's not going to be a question, do they take AmeriPlan?
Okay.
But the important thing is if you click over by sort by distance for a minute, Janice,
Right here.
that up at the top next to indicates it, see the gold orange where it says sort by distance.
Oh yeah, yeah.
And the reason I'm saying this is she has a lot of preferred providers in her area, but I had a member just recently was going to quit using the, cancel, because she says there's really no providers in my area. Well, when it defaulted to preferred, there was only a couple, but when we sorted by distance, there was a lot more near her.
Mhm.
Okay, Janice either has done a great job, somebody in that area is getting all these people preferred providers. But I always tell people it doesn't mean they're a better provider, because everybody's, Janice, what's the terms? Everybody's credentialed and stuff. I don't know the right terms. So it just means that maybe they haven't had contact with our corporate office recently. My dentist wasn't even under preferred, and I called and got him switched. Can I add real quick? I don't want to take it away from what you're doing, but if you see dentists like this and say you talk to them or one of your members and you find out that, for example, Great Expression Dental number 2, which is there's several of them, you call there and you find out, yes, they will still take AmeriPlan. They're still going to accept it. And that might take a little discussion with the billing person. Just copy and paste that information, put it in an email, send it to our provider. I think it's referral@AmeriPlanUSA.com and say, I've had contact with this office. Could you designate them preferred? That's simple. They'll change it for her. Or if you find out that one of those providers says, no, that dentist is no longer here, or we don't take any discount plans, you can ask them to contact AmeriPlan to go off the list. But I also take that to send them and say, will you contact this provider? They're saying they no longer take it. We need to help the corporate office keep our list updated and as many preferred. Like Janice, I love when yours opened up by preferred and you had like, woo, you had a long list. That's
Right.
good. And my area is getting like that because I've added a lot. Just that designation, just that simple designation.
Absolutely.
Okay,
Now,
thank you.
one of the neat things that has been added to the website, let's just say that I have made an appointment with Dr. Kim, who is on Highway 138, which is one of the main highways going through Stockbridge. And let's say that I have, I said, oh, I know her. I know where she is. That's down there by the Kroger store and the Kroger shopping center. I want to go. So how much is it going to cost me? Okay. Or how much am I going to save? Well, there she's under the red fee schedule, and it's going to give you an abbreviated schedule. Okay. Not everything is on here. It's just to give people an idea of what they would pay. In the first place that I go to, I give the ADA code for a comprehensive oral exam first visit. If you didn't have any insurance, you would pay $138, around $138. But because you are an AmeriPlan member, you only pay $35. That is a 76% discount. This is an excellent schedule. Now, if they want to get into some particulars, like the extraction is not on here, you would need to go back to the fee schedules that we just looked at in the back office. But some of the major things like orthodontics, under the red fee schedule, and this is not true with the Lyme unless they've done something recently, but under the Lyme fee schedule, orthodontics or braces or for children is there. There is a discount for them. But with the for the adults, there is not. But under the red fee schedule, it is a 64% discount on braces for our children, 62% discount for adults. Now, if you went to that dentist office with no coverage, no insurance, it's going to cost you around over $6,700. Okay. And yes, ma'am.
Oh, no, go. I want to.
Okay. And then if for the children, but because you're an AmeriPlan member, your child, you will not have to pay, but you will get 64% off of that $6,700. And so your out of pocket would be $2,450, around $2,450. I always say around because there's always other charges. Okay. But the majority, there is no insurance, individual insurance plan that I know of that has a braces benefit that can beat this.
Now, I do believe, Janice, and just so you, that orthodontics is if that general dentist does it.
Yes,
because if they do have,
yeah.
So if they
It's
do have an
all-
orthodontist in their location, it would go under the default to the 20 or 25% off. And I only know that too, because that's how it is at my
Right.
office.
Yeah,
And one
this
other thing I wanted to show real quick, go to where it shows crown. Oh, I'm sorry.
Go ahead.
Go to where it shows crown porcelain
Mhm.
fused to high noble metal. Make sure people, and though, if they get an all porcelain crown, it is not on this fee schedule. So it defaults to the percentage off.
45, yeah.
Yeah.
Mhm.
And sometimes people don't understand that. And Janice said it earlier, if it's on the fee schedule, anything not defaults to the percentage off, which is still an excellent saving for a crown. It really is. Like you said, if you don't think 25% off of, $1,000 or more, or 2,000 is a good savings.
Absolutely. Absolutely. All right. Something else I was going to say, but I forgot. Anyway, but anyway, it's always good to go over those higher price services like your root canals, your crowns, fillings and so forth. And of course, extractions are not on the sample, but you can give them you can go back to the fee schedule in your e-kit and get that. Now, let's say that I went to see Dr. Kim and I had a bad experience, okay? And I decided, you know what, I'm not going back to her anymore. There is a way to report that. And what you would do is you would find her on the provider list, click on the comments, okay? And it brings up her information. You put in your information, that's optional, and you put in your comment. Or on the other hand, maybe you went there and had an exceptional experience with this doctor, and you really highly recommend them, then you can put that comment as well. Okay.
That's new too, isn't relatively new, isn't it, Janice?
Yeah, yeah, with the upgrades, they added
Yeah.
that. And that's excellent. That's excellent because it gives you an opportunity. I know one of our benefit consultants, Fernie, was looking, trying to familiarize himself with the providers in his area to make sure that, the ones that were on the list were still active. And this was the place where he could, once he got his report, he could come here and put that in that information, like if that person is no longer on the provider list, if they have died or sold their practice, this type of information can go there as well.
Okay, that's good to know.
Mhm. All right.
Do
And
we have any, I think that's probably everything. We're kind of running a little bit longer, but I hope that this has been helpful. Janice, anything else that you wanted to cover with the, I think
no,
we got
ma'am.
most of.
I think we
And-
covered pretty much everything.
Excellent, excellent. Thank you. Thank you. Anybody have any questions? You can unmute yourself and we'll see if anybody, I don't know if I'm supposed to do that. I do want to say thank Rosanna. She saved the day because I didn't have the right setting because this is Lionel's and Angela has it all set up. So anybody want to unmute and say hello, goodbye, anything to us? Let us know that you're out there.
Hey,
Do I have to-
Mary, this is
Yes.
Michelle. You and Janice did a fantastic job.
Oh.
Fantastic job.
Thank you. Thank you.
Yeah, great job. This is Sonny, and I'd like to comment about the dental. I was in Kentucky and became a member because the braces for kids was so great that my coworker, I saved $4,000 on our kids' braces compared to theirs.
Oh,
We need that testimonial sent into corporate so they can share it. That's
That was
excellent.
some time back, and that's why I think I've become a BC.
Very good. I remember there's been other leaders and just people with AmeriPlan a long time, and they have similar stories that they used the business or the
Yeah.
plan and then they joined. So that's
Thank you.
great. That's great.
Mary and Janice, this is Ed.
Yes, Ed.
Excellent job. You guys are terrific.
Thank you.
Great information. And
Yeah. What's Janice showing over there?
I really didn't know that AmeriPlan had changed from coast to coast vision to Outlook till tonight. So
Yeah, that
it's
just
good.
happened recently, January
Oh.
1st. I'll be honest, I'm just, me, nothing but honest. I didn't know till I was going through the member guide.
Okay.
So
This
that's
is
when I
great.
realized it.
Great information, ladies. Thank you so much.
Thank you. Janice, do you want to give a?
Hi,
Oh, yes, go ahead,
this is
Lorraine.
Lorraine. Hi, how you guys doing? You all did a fantastic job. It was just super great. Learned a lot, and I thank you for everything you share with the team.
Oh, thank you, Lorraine. I appreciate it.
Yes, excellent, excellent. All
Thank
right.
Our last thing before we go, Janice is going to give a plug because next month, her and maybe her team, if not, I'm here to support her. What are we going to do on the next Zoom call?
We are going to smile and dial.
Kind of how our team does it.
That is my favorite thing, okay? And we're gonna go over, I know everybody doesn't make calls on a daily basis or in the days that they work, but I do, I always have. And I really enjoy it. And we're just gonna share some different scenarios that you run into when you smile and dial.
Yep. And then I think in April, Ed will be doing some training on group business. Right, Ed? He's muted.
You
But
know,
that's,
I'm here. I'm going to check with Lionel. I initially said I was going to do something on becoming
oh,
an
getting to
RSD,
RSD.
but I'll check with Lionel, see, I may switch back and do the other ones. One or the other, I'll get done.
Either one will be great. So, all right, well, we're going to wrap it up. I want to thank everybody, and I want to really thank Rosanna for stepping up and helping me, and I just reclaimed my host position, so just in time. All right, we're going to sign off. Good night, everybody. Thanks for joining us.